Ontario is now allowing pregnant healthcare workers who qualify for the COVID-19 vaccine to decide whether or not they want to get the shot. It's one of the questions that expectant parents have been asking themselves as they deal with a number of pandemic anxieties.
Pregnant individuals are a high risk group for developing severe COVID-19. And if we don't offer them the vaccine or systematically exclude them, well, we're risking their lives and their babies' lives as well.
Both the National Advisory Committee on Immunizations and the province amended guidelines for pregnant individuals as Ontario worked towards vaccinating healthcare workers. This high-risk population was excluded from initial vaccine clinical trials, so there is no safety data.
We do know that the vaccine companies are now including pregnant individuals in their vaccine trials.
The Centers for Disease Control is reporting that there are participants in the clinical trials who became pregnant, and they are now being monitored by vaccine manufacturers. And though limited, there is also data being collected from ongoing animal reproductive studies.
By the time that we go into phase 2, phase 3, hopefully we'll have more safety data by then. It will be easier to make a decision. Right now, it's harder.
On Tuesday, the World Health Organization had this recommendation to expectant parents. While pregnancy puts women at higher risk of severe COVID-19, the use of this vaccine in pregnant women is currently not recommended unless they are at risk of high exposure, such as healthcare workers.
Right now, when we talk about this risk-benefit discussion in terms of pregnant individuals, it's primarily for frontline healthcare workers who we know are at a higher risk of contracting COVID-19.
Though Ontario isn't making the vaccine available to the public just yet, this hasn't stopped expectant parents like Jennifer Curiotti from thinking about it. The soon-to-be mom of 2 is due to give birth to her son in June.
We're very cautious about this. Since it's still new, this vaccine, there's such a lack of information on the effect on pregnant women. So we don't know, well, how will it affect me? How will it affect my baby? Because it's not just myself that I have to worry about.
Dr. Bogler says these anxieties are expected, and it's crucial to have conversations with your doctor when the time comes and discussing risk factors like level of exposure and age.
Pregnant individuals over the age of 35 are more at risk of getting severe COVID-19 illness. Do you have underlying conditions?
She, along with a team of experts, created Pandemic Pregnancy Guide. Simply put, what to expect when you're expecting, but during a pandemic.
I really felt that we needed to be able to provide some sort of platform to, one, educate, provide the most evidence-based, up-to-date information, because there's so much misinformation out there throughout the pandemic, and 2, a place where expecting parents could come together.
And if breastfeeding and pregnant healthcare workers who qualify for the vaccine do decide to get this shot, they are being asked to sign consent forms in some cases and also have a conversation with their healthcare providers about risks and benefits. In Toronto, I'm Faiza Amin for City News.